For those of you that may be joining us right at 7 o'clock, we'll be beginning maybe at 7:01 or 7:02 to give everyone an opportunity to get live with us. So welcome, and we'll be with you shortly. Hello and greetings from Concordia College. Welcome to our latest virtual alumni event, Responding to COVID-19 with Dr. Amy Kircher. We hope you will join us for future events, including our online celebration of student success and virtual brews and brushes. Running from April 20th to May 1st, the celebration of student success is our annual undergraduate research symposium featuring a variety of presentation formats from students in all disciplines. You can go to the Celebration of Student Success website and see all of the many ways to participate in this celebration of outstanding Cobber Scholarship. Then on May 7th, we have virtual brews and brushes, which is just as it sounds, a virtual painting class with the beverage of your choice. You can learn about each of these events and future virtual events on the College Alumni Events webpage. We hope that you'll join us. Turning to tonight's event, we are so pleased to have Dr. Amy Kircher with us, along with Dr. Larry Pappenphus, to engage in a conversation that is on the front of everyone's mind: public health in a coronavirus pandemic. We're going to begin the conversation between Larry and Amy, but while they're speaking, if you have any questions you'd like to pose, please feel free to post them using the Facebook chat function. While they're speaking, I'll review the questions and try to pose as many as we have time for. So now let me introduce our presenters. Dr. Amy Kircher, a 1997 graduate of Concordia College, serves as the Director of Strategic Partnerships and Research Collaborative and Senior Advisor of the Food Protection and Defense Institute at the University of Minnesota. Dr. Kircher completed her doctorate in public health at the University of North Carolina, Chapel Hill. Prior to the University of Minnesota, Dr. Kircher held epidemiologist positions at NORAD, the United States Northern Command, and with the US Air Force, where she worked on health informatics, biosurveillance, and data analytics. She has an extensive background in Homeland Security and Defense, supporting preparedness and response for real-world and exercise events to include Hurricane Katrina and H1N1. And some of you in the audience will, of course, recall that influenza A virus subtype H1N1 is the subtype of influenza A virus that was the most common cause of human influenza in 2009 and was named a pandemic in that same year. It's also associated with the Spanish flu outbreak of 1918. Moderating the conversation this evening, we welcome Dr. Larry Pappenphus from our staff. Larry earned his PhD from the University of New Mexico and accepted a position as Assistant Professor of Health Education at Concordia in 1994. He served on numerous campus committees and received tenure in 1997. As an aside, it's during this period that Dr. Pappenphus first made a connection with the student who took some of his classes and later became the esteemed Dr. Amy Kircher. In 2003, he became Athletic Director and Chair of the Health Education and Physical Education Department. Larry joined the Office of Advancement as a gift planner in 2012. And in 2016, he was appointed the Director of the Dovry Center for Faith and Learning, which includes serving as administrative liaison to President Kraft for faith expression programs at the college, while still maintaining a major gift portfolio with the Office of Advancement. So let me turn it over to Dr. Pappenphus and Dr. Kircher. Welcome to both of you.
Great. Thanks so much, Eric. Really appreciate the introduction, and thank you to all of our alumni and friends that are joining us on Facebook Live. This is a real treat and a pleasure to be able to have a conversation with Amy tonight and to not only reminisce a little bit, but also address a very important topic to us. And so before we really dive in, Amy, to the COVID piece of this, I think it might be useful and helpful for our viewers to understand a little bit about maybe your Concordia story, how you came here, how your education at Concordia put you on this career path that now has become your passion. So can you talk a little bit about that with us first?
Sure. So I'm a maroon beanie. I'm a transfer student. I crossed the river from NDSU to Concordia my sophomore year, and it really was an awesome opportunity for me to do what I was passionate about, which was problem solving. And I found, the courses and the instructors I had, I was a biology and health major, allowed me to do problem solving. I love the question always, when a train leaves Los Angeles at 1 in the morning and New York at 2 in the afternoon, where will they meet in Kansas and what time is it? And so Concordia really allowed me to sort of engage in activities and take courses that allowed me to sort of seek that passion. I originally was pre-med and realized pretty quickly that I probably wasn't suited to sit in a physician's office. And I really wanted to I was always looking upstream. Where was the root of the problem, which led me to you, Dr. P. I have a hard time calling you Larry still. And what public health had to offer, and how I could engage in a way that was much more preventive than it was responsive and reactive. And so that was an awesome opportunity and transfer for me. I think the other thing that was my passion was getting all kinds of experiences, trying new things, getting experiences to add to my portfolio, and Concordia allowed me to do that. I did. I got up at 6 in the morning for, I think, one whole semester and did cardiac rehab downtown Fargo. I did wellness with a wellness person in the Fargo-Moorhead area, and I was assigned talking to junior high kids who had gotten caught smoking and had to come to class. They had to come to my class about smoking. So it was an awesome opportunity to do that. And, I was able to do what I want to do and where my passion was. So I was really appreciative for that it wasn't restrictive. My curriculum and my path wasn't restrictive as an undergrad.
Yeah. And I know, you had a lot of those great experiences at Concordia. Then post Concordia, you sought out and had some great relationships and some great experiences, among not the least of which is being on the front lines of Hurricane Katrina emergency response, but a lot of things that led up to that. So can you talk a little bit about what some of those experiences were that set the stage for your expertise today?
Once I knew I wanted to do public health, my next progression was to the University of Wisconsin at La Crosse, where I could engage in community health and really get a strong foundation in what does it mean to have a healthy population. From there, I pivoted and then started working for the US Air Force for the Surgeon General. And it was scary and awesome. And I learned, it was like drinking from a fire hose. I'm a kid from Minnesota who'd never been on a base. And all of a sudden I found myself 3 weeks after getting hired, pretty newly married to another cobber in San Antonio, Texas, and trying to figure out what did rank on the shoulders mean and what was chain of command and how do you implement, a concept of operations plan. So I learned fast, but I had great mentors like I had at Concordia, where I can still remember, and I'm still friends with one of my first bosses who used to sit next to me in meetings, and he had a notepad and he just wrote acronyms throughout the whole meeting so that I would learn, as people were talking fast about acronyms, I would learn what they are. And then he would take 5 to 10 minutes after every meeting and say, what questions do you have or what did you not understand? And he did that for a year.
Yeah. Very cool. And it was that unique kind of blend of experiences that was public health, but it branched into the military, which then branched into some emergency preparedness and emergency response. All of that kind of setting the stage for, White House briefings on anti-bioterror and being on the front lines of emergency response for Katrina. What kinds of lessons did you learn in responding to that emergency that might have some correlation with what we're dealing with the pandemic today?
Yeah, I really realized that I had a passion for response and I felt like I had something to contribute in that, again, moving back to that problem solving space. 2001, our oldest son, Jake, was 6 days old. And so it was a real sort of awakening for me for a career that I knew I could have and a path forward of how I could contribute to preparedness and response. And so I went to U.S. Northern Command, a brand new command stood up. That command, of course, was originally focused on terrorism after 2001, but really quickly evolved to an all hazards, especially since we saw Hurricane Katrina. And what I learned there from colleagues and leaders, and again, from, military folks, but also from just really amazing public servants in the government, is that in a disaster, we have to be adaptable and flexible. You will not have it doesn't matter what it is. You will never be fully prepared. A plan is as good as you thinking through it. That's a whole part of planning and exercising, is so that we think through all the possible contingencies. That will never happen in real life. And so being flexible and adaptable and having a willingness to respond to meet your mission, which Hurricane Katrina originally was save lives. So I set up a medical unit to do clinical care at the baggage claim of the airport, because none of their equipment was coming with them right away, but they could see patients right away. We moved one of the hospital ships to Mississippi. And so I learned a whole lot about the drag of that ship and how long it took to steam and how much it cost and where I could put doctors and nurses on it. And those are two of the ships you see now in the COVID response.
Right.
I had great leaders who, in the time, sort of those first 3 days when you're doing life-saving, who I would get asked questions. I say, we need to send a helicopter now to save, babies in a hospital where they just lost the generators and they're in incubators. And they said, go get it done. It was do the best thing given the tools we have now. And, once we continue to move through that, you learn how to be flexible and adaptable in a way that you never envisioned you could. And so real problem solving with people who know how to do it and have experience was a real awesome experience for me to learn that way.
I think it's an old military axiom, isn't it, Amy? You may have heard this, that no plan survives first contact, right?
Correct.
And once you get thrown into it, to be able to have the kinds of leadership skills and adaptability that you need to be able to be mobile and agile and make those decisions that solve the problems quickly and using the best information that you have to do that.
And really do critical thinking and judgment. You have to know the whole context, right? Conversations we're having now at the University of Minnesota are, when do we turn research back on? Well, one of the criteria is when we have enough PPE, protective equipment, masks and gloves that we could put in our labs that will not take away from our healthcare workers, right? That's perception and politics. You have to understand the whole context when you're making response decisions.
And I think often in the public, we only see a part of that, right? And so it's hard to make the kinds of judgments that professionals make in the public health realm there.
Yeah, and I would say my husband and my family, who are downstairs, hopefully not going to Facebook Live bomb this shortly, they'll see me yelling at the television sometimes when the media is reporting, like, why isn't there a plan for this? And I'm yelling at the television going, there is a plan. It's on shelf 2, part 5. And so I guess what I would say to everyone out there is, no, even though you're getting a slice of what's happening, no, there are incredible public servants and people in industry who plan and work on this. And, sort of despite what you think about administrations or politicians, there are career government service people that are working super hard and are implementing plans and being flexible and adaptable. And you will never get the whole story.
Yeah, right. Well, we're going to turn to some of the more specific COVID questions now. So, in the last week, we've heard a lot about antibody testing. And can you speak a little bit to the status of testing? What are the considerations as we try to move to get more people tested? And how will those results be used?
That's a great question. So I think the antibody or serological testing has just really hit the media in the last week. And those are the tests that will allow us to determine who's had the disease. And so we know this disease does not affect everyone the same. Some people are in sort of catastrophic consequences in ICUs versus there are some people walking around with no symptoms. And a good epidemiologist will always tell you, you need to know the denominator. How many people have had it? And we don't know that. We don't know if 50% of our population has already had it and been exposed, had the disease, and is recovered. And so really knowing that will help us sort of release from our social distancing and mitigation efforts. It will help us return to normal. Some of the considerations we need to think about is there's over 100 tests that have been validated and sent to the FDA. The FDA is allowing people to use those tests under what we call an EUA, Emergency Use Authorization. So they're not approving them, but they're saying, go ahead and use them because we're in an emergency. Accuracy is really important, and we don't necessarily know the accuracy of all the tests and if they're similar. So you don't know if some tests are throwing a false positive or a false negative. So that's really some of the challenges we have with the antibody tests right now. I know in Minnesota, I can tell you that Mayo is releasing tests. The university has made a test and is releasing those tests that I know are good. I would say though, there won't be enough for everybody right away. So we're gonna have to phase and roll out those tests based on some evidence base about who should be tested first. And then the last thing to consider is really, how do we use those tests? So do you get a gold wristband? Right. If you showed positive, meaning you've had it and you can now walk anywhere? What if you threw a false positive? So there's a lot of consideration. So I would say these antibody tests will be a good step forward to releasing and part of the solution. They're not the whole answer. We'll continue to have to do contact tracing and some of that sort of groundwork epi that we've heard a lot about. I'm so proud of the governor of Minnesota, who essentially gave a whole epi lecture in one of his press briefs about modeling. So I've sent him a little note on that saying I'm inviting him to teach one of my classes in the fall.
I have actually seen some information early on that, is looking at states and looking at maybe who is best prepared to deal with the pandemic. And both Minnesota and North Dakota were listed among those states that were in the area of most prepared to deal with the COVID-19, which was encouraging for those of us in the region here. Can you talk a little bit about the other thing that's been a topic, I think, of conversation recently has been the potential for maybe a second and third wave of the COVID? Tell us your thoughts on that.
Sure, we almost certainly will have those waves. So know that they're coming. We hope they won't be the height of the wave that we had this time. I know a lot of people, I saw as I was monitoring my Facebook feeds early on, people were calling for close down schools, start social distancing. We needed enough community spread to close down such that we didn't close down and then reopen and the whole wave started anew. What I would say is, one, we're gonna have to phase reopen, and when we do that, we will see more cases, right? Hopefully we're more prepared. We have some treatment options, and it's like you've heard for a month now, flatten the curve. We need to decrease the amount of cases over time to allow our cases to operate within the hospital capacity. So if we exceed hospital capacity and medical supplies and devices like ventilators, that's when we have a real trouble. So we're always trying to keep that caseload below our hospital, capacity to treat.
What do you think a potential phased easing of the emergency sheltering might look like?
Yeah, I think we started to see it this weekend in Minnesota, and I apologize. I should have looked at what North Dakota was doing or called my brother. We released and said, go to golf courses and go fishing, right? So that was a first step to say, okay, we can safely social distance. We've essentially all practiced for a month or so. So that is the first phase. I think the next phases are super important. We should not open up all at once, because when we do that, we put people at a higher risk, at a higher rate of exposure. So we don't want to do that, but that phasing might look a little bit aligned to releasing people that have less risk, or are not immunocompromised, or are younger. So based on who has a lower risk, we might release that way. I think some of the hardest decisions are around work, getting people back to work and starting the economy, and getting our kiddos to school. And there's a lot of conversations about letting them return and finalize their year and sort of close it out, or letting seniors graduate. And we have a senior in our house, and so and seniors at Concordia wanting to graduate, right? These are real challenges that have emotional real emotional reactions to them. And so we just need to be cautious. We need to use science and evidence as our base going forward to make decisions.
As we were preparing for this conversation, I remember, Amy, one of the things that you said was you were very proud of the response in Minnesota because decisions were being based on kind of an order of understanding of what the issues were going to be, our knowledge about the virus itself, that we didn't jump to do things before we had a knowledge base to do them. We did them sequentially in a well thought out manner, if you will. And that kind of ties in with what you're saying here about the release from emergency response. Do you want to talk a little bit more about, I know that you were kind of proud of how we handled it in Minnesota.
Yeah, I would say that we used good science to do it, and we continually reevaluate. And I think that's a real key, and that's something I've learned from my disaster preparedness and response days, is that it's a continual reevaluation. So the governor on Friday in Minnesota said, schools are open. On Sunday, he said, I'm going to have to close schools. So that was using science and evidence base to make those decisions and continually reevaluate. And I'm proud that they're doing that. I'm proud that North Dakota and South Dakota are doing it. I'm proud that many of our leaders at the state level, at departments of health across the country, are making those decisions and continually reevaluating, because we're learning. This is a new virus. We've never seen it. We don't understand completely how it works. I would say too, we don't understand how the public is going to react to mitigation steps we put in place. I would say in the Midwest, we're pretty behaved, and that is awesome. And so when we say we're going to restrict everybody to shelter at home, I don't think we knew how people would react. Would we see crime go down? Would people do rioting? Would people not care and continue to line our beaches, which, right, that's a Florida thing, not a here thing. Yeah. But all of those were unknown. So you have to sort of course correct the entire time. And it's okay to do that. And we should appreciate our leaders for doing that.
Interesting. When you talk about that, I think of when we were combating the floods here in the Red River Valley, and FEMA coming after having combated, flooding in other areas, and seeing that there really was a regional difference in how people responded here, and kind of this pitch in, we're going to get through it, let's do it, we're going to fill the sandbags kind of attitude, And I think there are probably some correlations with the pandemic in terms of our obedience to the shelter-in-place orders and things like that. It makes me think of, I gotta pull out my prop here. So, we have this really great seamstress at church. And so I've got my mask that she made in true copper colors. It's even got a little wire in the nose piece here, so it fits me really well. So I'm curious, what are your thoughts about how do these provide a good degree of protection?
I think we need to use our, again, PPE, our protective equipment, personal protective equipment, appropriate for what we're trying to do. So what you're using it for is a perfect use of that mask. When we put healthcare workers in place, or put people on the back, emergency responders on ambulances, they need a different mask than what you have on right now. So I think the awesome thing is that we're trying to figure out and utilize what piece of equipment is right for what you're trying to do and who you are. So moving about the neighborhood, going to the grocery store, picking up paint for a COVID house project, like my newly painted wall, right? I use that mask, but I'm not treating patients. And so really understanding what you're doing, and then putting the right tool in place.
Sure. And I think there's a degree of usefulness that people are feeling about trying to do things to help as volunteers and
Yeah.
to do their share in combating it, and to what can they do for neighbors and others. I know that you've had some real strong experiences with volunteers, and are there some recommendations you could make about
Yeah.
the best ways to volunteer and maybe the not so helpful ways to volunteer?
Yeah. I don't know. This might be an unpopular opinion, but I teach a whole lecture on why volunteers are terrible.
Oh,
And so I'll follow that up and
okay.
say, it is so important for us to support others and volunteer and donate in meaningful ways. And when I say that, align to an organization or align to a need. Make sure that you're not volunteering or donating things that aren't needed. So I've been in several responses where our community received teddy bears or rubber boots or, you know, more water bottles than they could drink in 20 years. That becomes a logistics issue, and it really wasn't helping. And so really thinking, you know, Minnesotans sending winter coats to Haiti post, you know, hurricane. So really think about how you can align to an organization that does this every day and does it really well. Or find a need. So do you have a community member that's in need, and try to figure out what you can offer and help, given sort of the restrictions we have right now. You know, there's some really creative solutions to being a good volunteer and a donating in a way where your donation is well received.
Thanks for that answer. One of the topics I want to touch on is, again, maybe more currently within the last week, is we're beginning to see some protests from people who I think the struggle is, there's this fear over the economic risk that we are facing in doing what we need to do to help spread the virus, help prevent spreading the virus, and then the public health risk, balancing those two. So how would you respond to what you're seeing and I'm seeing as some of the protests about, it's time to turn the economy back on?
I think this is so hard. It's hard on all of us. I mean, we're all struggling. We have maybe family or friends or neighbors that are now finding themselves unemployed or furloughed. And, you yearn for them and for their pain. And so we have to strike the right balance. Balance is the word I would use. How do we open our economy up? How do we, turn on the economic engine of a city in a way that also is very conscious about what we need to continue to do for public health measures? So I would say, turn that energy into creative solutions. How can you open up a store and implement social distancing? Every time I go to the grocery now, they've taken another measure, another step to protect each other and protect themselves and do business differently, which I think is awesome, right? They've pivoted and figured out how to do that. I think there are lots of our businesses that can do that and figure out. So right now I would say, figure out how to pivot so that you're ready to come back online when it's safe to do so. But it's hard. This is a real challenge, and we have to find the balance of where we keep public health measures strong such that we don't have a big wave as soon as we, fully release, but also start to turn on that economic engine in all of our communities. So, turning on golf courses and figuring out how they can do that safely and social distance. Going back to and opening businesses, thinking about if you own a restaurant, how, do you mask and glove your employees for a while? The pivot that we've seen, we live in St. Paul, lots of our local restaurants have pivoted to curbside pickups.
Yep.
They've never done that. You want to know what? I bet they continue, because I think it's been good business. So I think trying to figure out what are those pivots that we can do today or think about or start re-engineering so that we can come online faster in a way that is still conscious of public health measures.
I'm going to ask one or two more questions, but before I do that, Amy, I want to remind our audience that you can be asking questions on Facebook Live, and after I'm done with my questions, I'm going to turn it back over to Eric Johnson so that he can field some of your questions to Amy before we end our conversation here. You used the term pivot, and probably one of the most interesting conversations that we had in our pre-session was talking about this being an opportunity in the midst of the emergency to be rethinking how we do things. And you specifically talked about creating pivot points. And we had a very pointed conversation about that in higher ed, you being at the University of Minnesota, me being at Concordia College, and are thinking about what is this moment created in terms of opportunity for creating pivot points. Can you talk a little bit about that, how you see it, not just in higher ed perhaps, but other sectors of the public too?
Sure. I think for higher ed, for Concordia, for the University of Minnesota, this will push us in new and different ways of how we teach. You know, now we're figuring out online learning, which is awesome. The technology has existed. We just haven't had a forcing function. We have it now. So let's embrace it. Let's invite instructors and speakers and maybe faculty who don't live in Moorhead, but could really educate or, you know, empower a class or a student, you know, to get new information or knowledge. Could you have a community somewhere in the country that, you know, a Concordia class partners with, and they get online once a week to solve a problem? I think that's an awesome way to think about how we pivot, and really a mark to say, this is our brand and we are resilient and resourceful. And now we have all these new opportunities because we know how to teach online. We can have faculty anywhere. Our students can be anywhere. So if we have students that are, you know, like me, I like to take internships in different places. I could take a semester internship and still potentially take a course at Concordia. You know, how cool would that be? So we're no longer, you know, locked into a very rigid on campus, just who's in our sort of geographic sphere within a drive. There are really cool opportunities that we should pivot and start thinking about. How does Concordia or the University of Minnesota, how do we offer new things for our students in that time and space? I did have one other thing. I think it also allows us, you know, really cool interactive ways to problem solve and to create entrepreneurship. So I think this isn't just a public health teaching point, right? This is a point for how do you become resilient. I really hope the Offutt School of Business starts throwing disaster scenarios at the students and saying, figure out how you're going to maintain your business, right? How will you continue on if you can't talk to your clients for 3 months? So I think that's a really cool thing that, you know, the stories we're hearing about new businesses popping up or coming online because people are at home and thinking about new things is pretty awesome. And so that's where I would say, you know, academic institutions can pivot really and really create a new opportunity for students. That's exciting. This cohort, you know, of which are my children, you know, they want interaction. They want to problem solve. They want to think, you know, develop their critical thinking skills. And so I think we can pivot with that. I think other pivots that we'll see are one that I'm seeing, and I think Larry, you and I talked about it. What does online church look like?
Yeah.
How do we now have a bigger congregation that may come to church on Sunday, but just as many may be online watching, you know, with a cup of coffee and their newborn? So I think that's a pivot that our religious communities are being forced to do, and I'm proud of them. I've seen on Easter, I think we popped into 2 or 3 different services of our family members, and you know, that just gives another opportunity for people to engage in a meaningful way that they maybe weren't comfortable with in the, you know, previously.
Part of my new responsibilities since you were at Concordia is working with campus ministry, and we've seen that in our virtual chapels now, that we have greater participation now in our virtual chapels than we had when students were on campus, as an example of what you were saying before. I think with this, I'll turn it over to Eric to hear some questions that we might have from Facebook Live. And I'm going to stay on in case there's something I want to add to a potential question or whatever, but we're going to turn over the moderating portion with questions from the audience to Eric.
Thank you, Larry, and thank you to our intrepid watchers and listeners who have some really great questions, Amy. And you know,
I hope so.
Hopefully good ones.
I'm worried about the class of 97.
Well, there's some other comments that I won't actually pass along. No, I'm teasing. A lot of lovely comments, a lot of shout outs, and frankly, Amy, quite a few thank yous for your service. So let me echo what some of those people have said about the gratitude that we can have as a nation for the service that you've rendered, and the pride that we can have as Cobbers in you and what you've done. You've talked about it, kind of no specific order here. I may jump around a little bit, but Larry just asked about additional waves, and a couple of questions kind of come in the same zone of if there are additional waves, how would we handle those? Would it be reinstituting shelter-in-place orders? Would we need to go backwards and do some things differently? And then a secondary question or a related question was, what if the vaccine doesn't come when we hope it will, right? What if it takes years to develop and test? What does that pandemic response look like in that case? Is there any past experience that would tell us how we might handle that? So what happens in the waves, and what happens if we don't get the vaccine and the treatment that we hope as fast as we hope?
Great questions. And so with the waves, I think we all need to be prepared that we may release a little bit and restrict a little bit, and release and restrict. It won't be, I don't think it'll be a complete restriction, but it'll be a really conscious one. So really thinking through social distancing measures, really thinking through, how you maneuver through your community. And so we'll see some of that release and restrict. And it will be, the other thing I want to say is it'll be regional. So no, I think my parents are watching, they're in Pope County. They haven't had a case in Pope County. They're doing good social distancing, but at some point there'll be cases there. And if they have, a lot of cases, there'll be decisions that are made. We're seeing that in Worthington in one of the plants. I know there's some cases in a meat packing plant, I think in Wilmer. They're making decisions regionally because of the situation they're in. So we need to realize that not everybody needs to sort of release and restrict at the same path. This is going to have to be evidence-based, dependent on what's going on in your particular community. And so I think that's what we need to be aware of. If we release or relax measures and we see sort of this huge wave come back, in the fall when we're starting to see seasonal influenza, we might have to take additional precautions that feel more restrictive again. And I think we just need to know that's okay.
Amy, what do you think that means for international travel?
I think international travel is going to be tricky for a little bit. And I think I would say that because we really have to monitor what's going on elsewhere in the world. What is Spain doing? How many planes fly through Heathrow or fly through Amsterdam? We're all of a sudden, when we open up international travel, we become this global community all over again. So it's not that I'm just going to London. It's that I'm going to London and then maybe following on to WHO in Geneva. But the 2 planes I took have just been in Dubai and Tokyo. So I think that international travel will be one of the later relaxed items. So I think there's a lot of considerations in that depending on what's happening at other places. And again, it goes back to that regional concept. What's happening where, and then how do we safely engage and sort of remix as a world? Regarding the vaccine and treatment, tricky, right? We do not make vaccines in a way, and that's where I will continue to advocate and argue for funding to how do we do vaccine development better? How do we do it quicker? Right now, we're looking at, at best, 12 months starting in January, at worst, maybe 18, but there's testing and validation that has to happen. There are so many treatment trials happening now. I'm very proud the University of Minnesota is doing several of them. And so those trials, we're learning new data all the time about what works and what doesn't. So we'll continue. I think people need to know we'll continue to test and develop and use good science. we may not have a treatment regimen this summer. And so again, we go back to basic public health. How do we do good social distancing? How do we make sure we're doing good sanitation and hygiene? Wash your hands, safe practices that are just basic public health.
So Amy, a couple questions have a little bit of, I think what we all want to know is sort of, where does this finish, or when can we go hug somebody? You know, when, and some specific focus on May, right? Because here, you know, the governor is coming back to talk to us again on May 4th or something like that. And so a couple questions have come up relating to, do you have any predictive idea about, will schools open up again, or students go back to school in May? Will other restrictions like travel, and you just spoke about international travel, but will other restrictions be eased in May? And I think embedded in those questions that I can read are people on both sides of that, a little fearful to go back, and others that maybe are sort of ready. So what do you think? Are we going anywhere in May?
I think it is. I mean, it's hard and it's strange. And I have to say, I feel like throughout my career, I've gotten really good at being Amy Kircher, the epidemiologist, who thinks thoughtfully and rationally and factually and executes. And then I'm Amy Kircher, the wife and mom, who has a senior who wants to play lacrosse and have a graduation. And, you know, we have friends that are going to have weddings, and that's the emotional part. And it's hard. I'm not going to speculate on what the governor is going to do. I think we'll see relaxing. I think we'll definitely see relaxing of measures in May. I don't know what will happen about schools. I think schools is the one. Our governor in Minnesota, at least, is a teacher and was a coach. I think he has a senior in high school. So, you know, none of these decisions, and good leaders don't take these decisions, you know, lightheartedly. They think through sort of the emotional components to that. They think it through, you know, people losing their jobs. And so I think we'll see some relaxation in May. I don't know that I won't make a bet on schools opening or closing, because I have an emotional response to that. Certainly, I know that as, you know, Midwesterners, we'll be compliant. You know, we'll do what we need to do to toe the rope, and we'll help each other out. I hope we continue to see those relaxations. I would say, you know, and as I think about it, like I talk to my parents on the phone, and I'm like, oh, it'd be so good to just run up and give them a hug. And I think about our friends and high-fiving, my kids high-fiving each other on the field, and it's gonna feel weird, right? It's gonna be like, oh, can I touch you? You know, so I think we all have to recognize it's gonna be a little bit awkward, and that's okay.
You know, when you channel the scientist in you and the loving mother in you, you know, those two things, you know, you actually model internally what we see in the public debate in a way, right? And Larry asked some questions about that with respect to the protesters. One of the questions was, do you have any ideas about how we can have productive conversations? And the person who wrote the question wrote it from the perspective of wanting to know how we can have productive conversations with those who seem to doubt the seriousness of the pandemic or want to fight against the restrictions. But the reverse might be true as well. If I'm a person who feels like it's time to get the economy going again, how do I have a reasonable conversation with somebody who has a sense that we need more careful health practices? Any tips on that?
Well,
Not science, it's art now.
Yeah, correct. This is art. And I would say you start with grace. Yeah. Everybody's got, you know, you don't know where they're coming from. They have a different perspective. They might have a different background. They might be affected differently than you. You don't know that they had a friend or a mom or a grandma who had the disease. You don't know that they lost a job, or that they're not gonna, you know, have some special event. And so I think we all start with grace and have a conversation and really talk through, you know, what do you know, start with asking questions. What do you hope? What are your wishes? What do you miss the most? Or what are you most ready to get going again? And then talk about, you know, whether they're in opposition to you or not, talk about what you're most excited for, and then maybe what you're scared about, right? Those folks that have, are immunocompromised or are elderly, it might be scary to step in a grocery store for a little bit. And so, that's one thing we can do as neighbors is help them through that, right? Some people, it's going to take longer to come out of their houses, and that's okay. There will be employees at all of our places of work that say, I'm not ready yet. I'm still worried. Can I stay at home and work remotely for 2 more weeks?
Yeah.
I think we all need to meet people where they're at and have honest conversations. I'm a public health practitioner. All social distancing at this point is really good.
Yeah.
I see that the protests happen, a mile up the road from my house. And my first reaction is, what are they thinking? And then I had to remember, those are people who may have lost their job or they may have to close their business. And so, they want to reopen, they want to figure out solutions. So I have to start where they're at. What are they feeling? And then how can we collectively come up with a solution? So those are hard conversations. Start with grace.
So speaking of hard conversations, there's been a lot of focus on the World Health Organization, on WHO or WHO, and some scrutiny about whether they've done a good job or not, and whether they've maybe not handled all the information correctly or trusted China too much, or et cetera, et cetera. One of our questioners wonders about President Trump's order to defund the United States contribution. But I suppose embedded in that might be a broader question, Amy, about the role of WHO and whether they've done a good job in this particular context, and then perhaps what does it mean to stop funding something like that organization?
So when you all can fly, visit Geneva. It is a beautiful place where the World Health Organization is, and truly amazing people work there and work diligently with technical health expertise, but we have a lot of diplomats there too. The World Health Organization was a technical advisory body. They were not operational responders. That's not what they were funded for until Ebola. So post Ebola, they got a new mission to have an operations response unit. And so they are pivoting, but Ebola was 2014. So they pivoted during Ebola. The other thing is the whole world has to work with them. So if a country chooses not to notify, we have international health regulations. And of that, there are public health diseases and disasters that are mandatory to report. Not all countries report as they're supposed to. So that's a real challenge. And they have to handle the public health technical aspect as well as the political aspect. And so we have, the one thing I always tell my students is we have no health referee for the world. WHO is a technical advisor, but they will give guidelines. They will offer recommendations. They will deploy people in support of the disaster in your country. They are not the arbiter of health for the entire world. So I often don't talk politics. I don't typically share sort of where I affiliate in the world. I think we have to fund the World Health Organization. It is a necessary and absolute must. And that we have to fund World Food Program, those organizations in the UN that help understand how the world is working and where we have challenges. There are people embedded in countries that help notify. So the WHO is a key component into us having a healthy world.
Amy, let's stay, let me just stop for a minute and say thank you for that candor and for the wisdom embedded in that, about helping us understand sort of what the real core function is, aside from some of the noise and politics that we see. Mm-hmm. Staying on the political or the governmental level, maybe not political, but the governance level, mm-hmm. You've had positions that have had you placed very closely to decision makers making national policy decisions, and had those policy decisions where you provided your input on those. One of our questioners wonders about whether a pandemic like this can be or is considered a national security threat, or maybe something like maybe this one hasn't been declared that in a way, but maybe some other public health crises that you're familiar with have risen to a level where we might describe it as a national security threat? And if so, in your experience, does that change the government's actions in some way or another? Does it change the dynamic if we use that particular terminology?
I think I want to add to that, Amy, too. I know how passionate you are about protecting the people that protect us. So what are the implications for our military?
Yeah, I have lots of comments on that. So let me just throw them out in no particular order. One is we will most certainly see evolutions of how we respond to how we prepare and how we respond, right? After every major disaster, we figure things out and do it better. You know, the 9/11 report, the post Katrina report, the H1N1, post H1N1, we figure out how to do things better and differently. And we most certainly will do that here too. I would say right now, from a national security perspective, and not just thinking about our military, is we need to really understand our supply chains, and we need to know what is our industrial base in the United States. So let's just one, project that I work on and I'm passionate about is the food supply chain and the drug supply chain. We don't make vitamin C in this country, and most of the active pharmaceutical ingredients that make a drug are produced in India and China. So what do we need to do to bring that industrial base back to the US so we are not reliant on the rest of the world? So that's where I would place sort of my national security concerns. Certainly our military, we need to take care of them. We need to think about how are we protecting them, whether they're at home with families or they're deployed in theater, and how do we make sure they have everything they need to be protected? Certainly we've seen news stories about ships and cruise ships and naval vessels, and really thinking through what do we need to do? What do we implement from a force health protection, both guidance and strategies?
Well, as a retired naval officer, Amy, I'm certainly very interested in that response. It's been I don't know what, it's been instructive to understand how this pandemic has affected the supply chains that you've described, our health supply chain, our food supply chain, and how it can affect military preparedness or preparedness in health systems in other places. So
yeah, I would say making cars,
yeah.
Making all those things that we import, your favorite wine or European something or something, all of the berries and bananas we import from, South America. This is what I refer to as cascading effects. We're going to have secondary and tertiary effects from the primary disaster. So we'll have cascading disasters where they were created by the pandemic, but they will become their own. So really, again, it's time to pivot. How do we make sure we're not dumping milk? Can we spray dry milk? Can we put it into a new system or a new format such that we can intake it a different way so we don't dump milk? How do we realign logistics so that we're not letting tomatoes rot in fields, but we're getting them to homeless shelters or food banks where they can use tomatoes and they're not being used by restaurants? That requires a pivot, and we have to think differently about how we're moving trucks.
Amy, let's talk about the healthcare system for a moment. One of the questions that was posed is one that I haven't thought about myself, and I haven't heard posed in any other place. And the questioner says, as the pandemic has progressed in the Fargo healthcare systems, they've experienced markedly decreased census numbers, right there. And we know this is true at the Mayo Clinic. They're at what, 35% bed capacity or something, right. And elective surgeries, and elective treatment, meaning almost everything that isn't right. really life-threatening and COVID related right. have been shut down. And we know that there's economic stress on the health systems, the very health systems that we want to survive, because they're not billing. Mm-hmm. So that's question number one that maybe you have some thoughts about. But the one that the questioner poses, if we come back to a relative normal state, is it possible, and have you heard any talk about whether healthcare systems will be overwhelmed with the treatments that have been delayed? Some, very elective, and some like delayed knee surgeries that need to happen, or, diagnostic procedures like a colonoscopy or what have you. So is there a worry of a surge to come for a different sort of treatment?
And I would say, let's be good planners now. Let's figure out how to prioritize those that are the most needy, to those that can maybe wait another couple months. Right now, we're social distancing and we have a gift of time. Let's re-employ those people who aren't seeing patients to help us solve new ways to bring people in and prioritize who needs a knee surgery first. Who needs to get their wisdom teeth out before somebody else, because it's going to create pain or some, destructive element in their mouth. So right now, let's spend the time planning. How do we restart in a way that doesn't overwhelm and we have good prioritization of care? Because that will help us with supply chains. That will help us with our healthcare workers' ability to treat effectively, and fix knees and do LASIK and, all those things we expect to do. So right now, we have the gift of time. Let's plan.
Amy, just a couple more questions before we finish. One question came in about whether there were any particular things you'd like to say to President Trump. But let me just pause and add to that and say, as you look at executive leaders throughout the country, whether it's the President of the United States making executive decisions on behalf of the United States, or governors, Minnesota, North Dakota, other governors in the news, New York, Georgia, Michigan, California, if you were going to say sort of, this is what's on Amy's heart to those leaders, what would you say?
Get good people. Get those people that can give you the information you need to make good decisions. And those people aren't always the people that agree with you. Sometimes they're the people who don't agree with you, and you need to consider their perspective or their background or how they might be reacting to this. So, right now, get really good scientists, get good people who think about the law, get ethicists involved, get those people and get the people that are your clients or your community or your population, right? Let's put students on committees right now about how to restart a university and how we pivot. So, put those people. So surround yourself with people that can help you be thoughtful about your decision-making from a both technical, factual, legal perspective, but also from an emotional perspective. And so I would say that, I was able to say that to some of the principals that my kids, of my kids' schools. I would say that to President Trump. You have career service individuals who can help you with this. Use them, right? And listen to the voice of those that agree with you, and listen to the voice of those that don't agree with you.
I'm going to really put you on the spot, Amy, and say and follow up on one of Larry's questions. This is one of my own. We know that in a policy decision like this, the executive leader has got a variety of experts that you've just described, and if they surround themselves with the really good ones, they're going to be, and they listen, they're going to have experts who want to manage risk in different ways. So the public health risk manager like you might say, this is what shelter in place should look like. This is what restrictions should look like. This is how we ought to live. And this will help us manage the risk to our health. Meanwhile, the economic advisor says, I'm going to help you think about managing economic risk. And if we do some of the things that Amy's described, certain things are going to happen in our economy. And they may be good things or they might be bad things. And there'll be maybe another public safety person talking about military safety or police safety or that sort of thing. And I bet you've been in a room where those risk management recommendations haven't aligned always. And we know right now the risk management alignment between economic risk and public health risk are sort of at differing ends. What's your experience been with that? And what would you say to the executive leader who's looking at that?
Well, those rooms are loud and stressful, and I've been in plenty. I think the one thing that I learned from the military, and Eric, you can attest to it, is, come together and build courses of action and then quickly model them. So what if we open this, but don't open that? What if we release and open up the economy, what are the after effects? And then really think through what's our risk tolerance? What is acceptable to us, right? And so I think, again, the word here of the night maybe is balance, but think through put all the options on the table, or as many as are feasible, and really work through those scenarios and say, Amy, if we relax on May 4th, what are the public health consequences we might see? And then what are the economic opportunities we'll have? And then look at the balance between those. Is there a difference between May 4th and June 4th? And so I think, good people have to come together and really model out and hash through some of these decision points. And we're going to all have to come to a collaborative decision, right? I don't think there's no one extreme or the other. It's going to be somewhere in the middle.
Amy, I'm gonna ask one last question. There are some others that have been posted, but I wanna be mindful of our time and to be sure that we finish when we advertise that we would. I know that you, and we've talked about it a little bit, have a great place in your heart for those people on the front lines, the military folks that you've served with, the first responder types, healthcare workers, the people that are involved in public health writ large in our country. We see an especially heavy toll among our healthcare workers, an emotional toll of worry for their own health, the health of their families when they come home from the work that they're doing, and a heavy toll literally, physically on them with their own infection rates. What are your thoughts about how we can best support our healthcare workers? What can we do if we wanted to do something for them?
Yeah, let's get creative. So, figure out how can we best help them. It is getting lovely and warm in spring. Who needs their yard raked? Who needs some landscaping done or mowing done? Can you, let's start a meal train for the nurse that lives down the street and everybody on the block takes a night or takes, every Saturday. Let's get online and figure out how their kids are doing with online school. Can you get online and help them work through their math problems because mom or dad is busy working and the other parent is, helping the other kids? We have incredible small businesses across the Midwest, across the country. And so, one thing our family is doing is every week we pick a small business from locally, but also from places we've been, and we buy something from them. Could you buy gift cards and send them to them? Could you, order something from a small business who really needs you to spend money in their shop and send it to a healthcare worker? So I think we just get creative, right? How do we help them with the things that feel hard now? Maybe cooking dinner, maybe helping with, math or reading, get online and read a kid a story, drop off. One thing we did, which was super fun, is we have some neighbors that have little kids. We Easter egg bomb their yards, right? For those parents, it was one distraction in the day of a very long week. So think creatively about what are those things that we can do and use our small businesses, to help keep them afloat and maybe get something to those healthcare workers.
And I would add, if I might, one additional piece to that, Amy, those are awesome suggestions. And from dealing with, our own health crisis in our own family, one of the things that we've learned is the best way to do that is to just show up and do it.
Yes.
When we were asked, what can somebody do for us? What can we do for you? Most often we did the Midwestern thing, which is to say, no, we're good, even though we're not good. And then the second thing was we were in some ways so broken, we couldn't even say what we needed. Yeah. And we would almost assuredly have never said, please put Easter eggs in our lawn. So what we learned and what we've tried to add in our lives is perceiving what might be helpful and then doing it without asking, because sometimes it seems to paralyze people. But
send mail or bring in, if you have an RV, bring it to a healthcare worker's house so they have a safe place to sleep in, so they're not sleeping in the treehouse.
Yeah. So, well, thank you so much, Dr. Kircher, for being with us today and providing us the wisdom of your experience and your profound perceptions. And I mean that profound, literally, extending grace, one of the things that you recommended to us is maybe one of the most important things that you said tonight, at least in my view. So thank you so much for being with us, and we're so proud to claim you as a cobber. And Dr. Pappenphus, Larry, my colleague,
Yeah.
thank you for moderating. Thanks for mentoring a student like Amy.
I want to add my thanks to Amy, and I also want to share that I remember in our conversations that one of the things that attracted you to Concordia was the mission, and that you really found a place where you felt you could have a part in influencing the affairs of the world. And we're proud that you are doing that in meaningful ways, and proud of your accomplishments and proud of you.
Thanks.
Yep.
And to our audience tonight, thank you for being with us. If you'd like to rewatch tonight's program, if you dropped on a little bit late and you didn't see it all, or you want to rewatch it, recommend it to somebody who was unable to see it tonight. You want to gather people and do a watch party at an appropriate social distance. We will be posting it on our website in both our Ustream and our YouTube channel. So you'll be able to see that online soon enough. We look forward to seeing you at future events, for a while virtual, so watch for those. And we look forward to seeing you in person when that's appropriate. And we so thank you for all your continued support of Concordia College. So we bid you good night and best wishes and good health.